meeting. Excellencies, distinguished guests, ladies and gentlemen, and we have a global audience that is watching us via live stream. On behalf of the Global Fund, COP28 Presidency, the Green Climate Fund, the Rockefeller Foundation, the World Health Organization, and the Clinton Global Initiative, welcome to the Climate and Health Finance Dialogue, co-hosted by Amref Health Africa and Foundation Yes. My name is Dr. Githinji Gitahi. I'm going to be your master of ceremony this evening. And I'm delighted that you're all here today. And today we also had a milestone that actually WHO got its 14th program of work approved, and with climate and health as one of the 6 work streams. Congratulations to WHO. And Maria, thank you. Good job on that. We are making progress. Never mind, I know and I hope that the climate and health resolution will also be, I see fingers crossed, isn't it? There are challenges there, and you can all guess what the challenges are. It's a small problem with a huge impact. It's gender. So let's hope that that can actually be resolved. That's where we are as a world. So we hope that we will be able to make progress on that. But to the nations, the member states that are supporting this, Netherlands and others, thank you, and for continuing to push forward on this. We, the people, will win eventually. So we are very happy to be where we are. This is an important moment, and this is an important moment because I can't imagine that 30 years since the beginning of COP, we are actually having a resolution on climate and health. And at COP28, we actually had a discussion on health. It is finally dawning on everybody that actually health is the human face of the climate crisis. So we made tremendous progress. As we all know, and that's why we're here, climate change and the climate crisis is actually going to be, and it is already, the largest or the biggest global health challenge. And this is where we gather here to say, if we know the challenges, what shall we do about them? So whereas progress has been slow, we have seen that progress is accelerating. It's accelerating because when we went to COP28, we had a health day for the first time. We had a health day. I remember going to COP27 in Egypt, and I see some people here from COP28. Well done for what you did to bring health on the table. And when I went to COP27 with a team from Amref, we went there, and of course there were others, PMNCH and Lancet Commission and all these people, and we were looking for health. We tried, actually, Naveen, you're here from Rockefeller, and I must apologize today for not spending your money well. Naveen had given me money to go and convene ministers of health in Sharm el-Sheikh, and we couldn't afford to get a single minister. And when we asked the ministers why they didn't come, they said, why would my president allow me to travel to COP28? It's not for the health minister, that's for the environment minister. In 28, we managed to get 100+ ministers of health into the room in 1 year. I come from Kenya, where we had a devastating flooding incident just a few days ago, more than 300 people dead, more than 50 health facilities destroyed. I was told at the last count, we had more than 1,000 pregnant women displaced within about 58,000 households. We have a cholera outbreak, as has been in Malawi and other places. So we have all these things that are going on. So we know that there's a problem. And we know that this climate change is a profound threat to our health systems. So there is a lot of work that needs to be done. And we know that the most vulnerable countries, the ones with the lowest carbon footprint, 0.3 metric tons equivalent of carbon in Africa, 14 metric tons per capita in the US. But when the impact comes, despite the fact that for the poorest, the contribution is less than 3%. As I like to say, the impact will not have a 97% discount coupon. It will be equal and massive, and because the health systems are weaker, the impact will be multiplied. And therefore, we are talking about the vulnerability is going to be exacerbated by the climate crisis. So today, we are going to consider this issue, but we are going to consider it from multiple dimensions. The first dimension being that we want to look at the state of play, the global political landscape, and the collective will to advance this agenda. So that will be the first thing we'll be looking at. The next one will be, what are we seeing, hearing in countries? So we have ministers of health here, we have CSOs or community people, and we are going to hear about, so what's going on? How are they dealing with this impact today? And what challenges are they facing? And what are the concrete actions that are needed for financing? And then finally, we are going to get into how to surface these funding gaps, these challenges, and say, so how can we address them? So those are 3 panels, each strictly 20 minutes. And we have great moderators for those. And they have promised me that they'll be ending in 19 minutes, saving us a minute per panel. I just had a chat with Peter Sands. He promised me that he will actually tell his panel that they are the ones in between us and the reception. And therefore, they'll have to save time because the reception is important. The fight against deadly diseases must go hand in hand with the response to climate change. We know that, but with equity at the heart of our actions. Ladies and gentlemen, it's my pleasure now to invite our first keynote speaker, who is speaking to us live from New York, a strong advocate, a long supporter, and a champion of the climate and health agenda. This is none other than Dr. Chelsea Clinton, Vice Chair, the Clinton Foundation. Please connect Chelsea. Welcome, please. Chelsea, this is your moment now.
Oh, gosh. Thank you so much, Dr. Jitani. I'm so sorry to not be able to be there with you in person. And while you were reflecting on kind of the recent climate catastrophes in your home country of Kenya, I was thinking about the terrible tornadoes in my original home state of Arkansas and how our national weather forecast tells us that we will have the worst hurricane season in the Atlantic in history. And so we certainly know that climate change is falling most heavily on our most vulnerable, indeed in the countries that have done the least to contribute to our warming climate and all of the attendant effects on climate change. And yet we know, very similar to our conversations around pandemics, that climate change will affect all of us and that we all need to kind of work together to solve this truly unprecedented existential crisis. I'm incredibly proud to be, as you heard, the vice chair of the Clinton Foundation, an organization started more than 2 decades ago by my father to help us be part of the effort to ensure that antiretroviral medicines could reach kind of everyone who was suffering with HIV and AIDS, so that kind of anyone everywhere could have the experience that by then patients in the United States and the global north were having, that it was a chronic disease and not an inevitable death sentence. We know that we need that same type of big multi-sectoral urgent action today on climate change. It's incredibly positive momentum, as we heard from Dr. Jitani, that COP28 indeed, after 27 times of not having climate and health on the agenda together, finally had climate and health on the agenda together. But we know kind of momentum only continues if we align political will and financing and kind of civil sector and private sector action all together. And certainly at CGI, we hope to bring those disparate partners together kind of with kind of shared vision, shared accountability, and a shared sense of urgency. And we can't think of anywhere we should be purposing our time, energy, kind of convening power, except really at the intersection of climate change and health. To me, certainly as a parent, I was thinking when Dr. Jitani was talking about kind of the pregnant women who have been so affected by climate change in Kenya. We know how dangerous a warming world is to our elderly, to our kind of youngest, and certainly to our pregnant women. In a moment where kind of we like to think that we are doing all that we can to value life, we have to think about how we take those values and take our urgency and really manifest it in having real commitments for real action to tackle climate change. And certainly we at CGI, at CHAI, as our family kind of stand ready to kind of be in partnership and to follow all of the extraordinary work that we know will be happening over this week of the WHA and the work that we know will have to happen coming out of WHA and toward COP29. So just incredibly proud to be in this work together, grateful to be in this work together, and we'll kind of hand the proverbial microphone and actual stage back to Dr. Jitani.
Thank you very much. Thank you, Chelsea, for your call for urgency and also declaring your support for this as we look forward not only to the other two COPs, but actually to working at country level beyond the COP to actually make this change happen. Because as we know, we are not looking at climate change and climate crisis as a risk. It is actually a reality. It is here today, and we'll be hearing that from the countries. The next keynote address is going to be by video by the Director General of WHO, Dr. Tedros. So please give us the video for Dr. Tedros.
Excellencies, honorable ministers, dear colleagues and friends. Climate change is increasing disasters, driving hunger and water scarcity, and fueling the spread of infectious disease outbreaks. If we fail to integrate climate risk into health systems and key health programs, we risk a devastating ripple effect of disease, death, and poverty. However, currently, climate change and health funding falls far short of needs. Just 2% of adaptation funding and 0.5% of multilateral climate funding go to health. The health gains from climate change mitigation and adaptation outweigh the costs and are a compelling argument for stronger climate action. Climate action could save millions of lives each year and generate a return of over $4 for every dollar spent. These actions include protecting vulnerable people from the health impacts of heat waves, investing in renewable energy for health facilities, and removing subsidies for polluting fuels. We also need to invest in health and care workers to meet the increasing demands inflicted by the climate crisis, including severe weather events, food insecurity, and disease.
All right, okay, please. Clap for Tedros. Yeah. Please clap for Tedros. Thank you very much. Thank you. And re-emphasizing the importance of gender in this conversation, because 70% of the health workforce is women. The people who are impacted by water scarcity are women and girls. So keeping all those things in mind, and also making the economic argument that there is an economic case for investing in health adaptation and also in mitigation to reduce carbon emissions. So thank you very, very much, DG Tedros, and also for the WHO support. I said earlier that the fact that the 14th program of work for WHO now has climate and health is a galvanizing effort for all of us to say now, as we work at a country level, as we work with the COPs, there is a framework for reference. So really, really grateful. And therefore today for me is a really great day knowing where we have come. So allow me now to introduce the next segment, which is going to be a panel discussion entitled Global Political Commitment. And this is going to be moderated by none other than Dr. Naveen Rao. Dr. Naveen Rao is a Senior Vice President, Health Initiative at the Rockefeller Foundation. So please, Naveen, I think you sit to my immediate left. And to save you the time on the panel, I'll introduce your panelists. Thank you. Good. So Dr. Naveen is going to be joined by Dr. Maha Barakat. Please join us next to Naveen. Dr. Maha is the Assistant Minister of Health and Life Sciences at the UAE Ministry of Foreign Affairs, UAE Ministry of Foreign Affairs, and also part of COP28. Next is Excellency Pia, Minister of Medical Care in Netherlands. I try to avoid pronouncing your second name, forgive me. Where I come from, we don't have the letter J. So, yeah, I didn't want to butcher your name. The next panelist is Excellency Geraldo Miguel Saranga, Permanent Representative of Mozambique to the United Nations. Yeah? No? Amindo Tiago, sorry. Please, Amindo, this, let me see whether I have all the names right. Yes, Tiago, welcome. And the next person is Mr. Maziko Matemba, a climate and health champion from Malawi, and also a community health systems champion. Welcome, Maziko. And over to you, Naveen.
Thank you.
Your 20 minutes start now.
Yes.
Thank you.
Thank you. We'll keep to time. When most of you get on a plane, well, it's been a long day, so I'm going to start on a lighter note. When most of you get on a plane, you'd like to know one last time this plane is going to Chicago. Same way, I want a show of hands. How many of you really think climate change is affecting global health? Okay, so you're on the right plane. You're on the right, you're in the right plane. You're in the right room, and just wanted to make sure you're all here because what you're going to hear on this panel is the two most important things when it comes to making any change: political will, financial commitments. Without politics and without money, you have no chance. So that's what we're going to discuss today. Really, really eminent panel. I had a chance to talk to all of them. They allowed me to use their first names, but I did take the effort, Gitinji, to find out that it's pronounced Dijkstra. I had the same problem, but I took the effort to find out. No, I'm just rubbing Gitinji. But truly, I've also asked the panel to make this personal, and that I'm going to ask them not just academic high-level question, but try to bring it to their level and their personal impressions on this. So we have here an arc from COP28 to COP30 today. You'll hear all the different perspectives between COP28, 29, and 30. We're starting here, and I don't know Dr. Barakat needs to leave early, so I'm going to start with you, Maha. Maha, looking at what happened on the health day at COP28, you heard everyone talk about it, from Chelsea to Tedros, and everyone talked about it. There are some people in the room who believe that we achieved what we said we would, and there's some people in the room who think we missed the chance to do more. You were in the cockpit with COP28. You were flying the plane. What is your thoughts?
Well, thank you very much for inviting us to participate in this discussion. And I'm really delighted at the audience and the attendance, the interest in the topic. And incidentally, I understand that many more people wanted to attend. So I in many ways, I'm delighted that there's so much interest in the global health community. These are very important questions. I remember last year, and in the build-up to COP28, when we were, looking at creating the first climate health day at any COP, we were working with our colleagues from the WHO, and of course, Dr. Maria Neira is here, and she was an incredible advocate for this topic, and really a huge thanks to Dr. Maria's efforts for what we've achieved and where we've come to today. We didn't know what success would look like. We heard from colleagues in the WHO that maybe if we do get a health day, if we do prepare a declaration, maybe 40 countries signing off, maybe 50 countries, you'd be lucky. You saw what happened in November, and on the 3rd of December was the actual health day. We now have 150 signatories around the world to the Climate Health Declaration. So Thank you. And I think that represents the countries that you've all come from. We have 150 countries that have committed to prioritizing the health agenda in climate discussions, to looking at including health in the nationally determined contributions, the NDCs. And I'm so pleased that people are now, the ministries of health are now getting used to the letters NDC. So up until now, we heard yesterday from the event in the Netherlands, a very important, very salient comment was made that usually ministers of health think you're talking about NCDs, non-communicable diseases. And now ministers of health have to get their heads around the fact that they actually have to get involved with NDCs and make sure the health plans are incorporated in the NDCs. And not just that, and this is relevant to today's discussions, of course, it's to include a financial aspect. So not only to talk about it and include it as a priority, but make sure there are domestic financial resources allocated to dealing with health issues related, climate issues related to health in the NDC. Now, so I haven't quite answered your question. Is that enough? Is 150 signatories to a declaration enough? I think at the end of the day, we have to look at how many lives have we saved. So by the time we come to COP30 in Brazil, if there's a way of translating the impact of the declaration into how it translated to saving lives by COP30, I would say that would be the ultimate sign of how successful COP28 was. Thank you.
And I know, wait, you're not off the hook. I know you have to leave, so I'll ask you your follow-up question now. So there's the COP29 and COP30. So what would you tell them not to do? She was good.
So definitely don't give up on the health day and don't give up on keeping the momentum going. I think this is, so we were really fortunate. In November, we mobilized $1 billion for the climate and health agenda. And I hope that similar events will happen, at least in COP30. Thank you.
You've been terrific. Thank you, Maha. I'll let you off now. I know you have another event to go to. You whenever you feel it's up to you. Pia, I really appreciate your joining us. Yeah, give her a big hand. Pia, just continuing the conversation, Netherlands has taken a lead in the WHO declaration negotiation. You must have learned a lot in that process. Also, we do believe you can teach us a lot. So what would you tell us about that whole process of how do you put the declaration and what role does a country like Netherlands or people sitting in the audience can learn from that?
Well, it's when you look at it, I would say, what did we learn? That climate change is on top of the agenda of everybody, which of course is very important because you can only reach it. That's what we found out also in partnerships. For instance, within governments, within universities, within society, the whole of society, young people. I'm very proud that it was the idea of a young delegate last year, a young doctor of the Netherlands that showed us the way. She asked us to put it on top of the agenda. And so we did. And then you start and you have to convince everybody. Not everybody is convinced immediately about the way you do it, but it is, we managed to do it, and the resolution is being supported. And I think that when we look at, let me say, it is important that it is one of your priorities. For us as the Netherlands, it was one of our priorities within our Dutch global health strategy, and that was launched last year. We started the process as one of our first steps, concrete initiatives for this resolution. And what we also learned is that it is, of course, the climate change and the effect of it, and the threat posed by climate change is multidimensional and global in nature. And we therefore sought to promote integrated action at the nexus between climate change and health, working across sectors and across borders. So I think I'm trying to remember if I'm giving an answer to your question right now. This is what we learned, and I don't know if we can teach about how we reached this result, but I think it is also important that you are convincing in keeping it on the agenda and trying to get everybody to see the solutions that we found. And as mentioned, I said the threat of climate change is not only multi-dimension, also global, and therefore we needed cross-regional collaboration. And this is also one of the reasons why the Netherlands explicitly collaborated with a cross-regional group of countries to draft the resolution. Of course, we were not alone. We worked together with Peru, who was also our how do you say that? Everybody's trying to tell me now, but our co-host, let me say it like this. Over the past few months, we have led various rounds of WHO consultations here in Geneva, and we are really highly grateful also for all the member states from different regions for their constructive participation, if you allow me to say this right now. And we really hope that our side event held yesterday and hosted or chaired by Mr. Maria Neira has helped to show how the resolution can be implemented in a way that is both practical and beneficial for all. So I would say let's seize the opportunities and seek to optimize the benefits for all.
So the follow-up, the tougher follow-up question.
Absolutely. Yeah.
You saw what happened during the COVID crisis with the way that vaccines were hoarded and nationalism rose its head up. What protects resolutions like this from a piece of paper to actually saving lives?
I think that these resolutions are very important because it is an example of how we can cooperate on these matters. And I think that was what was missing during COVID pandemic. And now we are preparing for a possible next pandemia. And when we also take in account climate change, I think we have a much broader view right now on this topic.
Really appreciate it. Thank you very much, Your Excellency. It was wonderful. Appreciate it. Armindo, Mozambique, you have some of the highest vulnerability indices, yet you've managed to be data-driven, you've managed to get cross-sectoral partnerships. People talk about it, but actually you've done it. Question, what makes Mozambique special?
Thank you.
There's a tough question coming after that, so
Yeah, it's
I don't
okay.
want you.
I'm not sure whether Mozambique is special or not, but what I can say is that Mozambique, it's really facing a problem due to climate change. One, in general, every single year, we do have between 4, 3 or more cyclones. It's flooding, people displaced, they destroy infrastructure, social, health sector, hospitals, etc. Then, if you are living there and you face all this challenge on annual basis, you need to find a solution. It's a survival process. I think this is the word. It's not being special, but we need to adapt in order to survive. So we went into 4 different steps. The first one, we went there and we did an vulnerability assessment to look at what are the areas that are at highest risk in the country. And we came with a result of 24% of our districts are located in a high or very high vulnerability risk. And then in the second step, what we did was to create a national health observatory on climate change. The role was to define and draw maps of these specific places where the risk is the highest. And then we went into the third stage. We draw a plan of response. The response, it involved everyone in the country. It involved the Minister of Transport, Building, the Minister of Health, everyone, including our partners. Without them, we wouldn't do anything. And that plan, it allows us to respond timely to any event that happens. And then the last one, I think is this one, it's advocacy. We need to go there, tell you once again that we are at the risk, other people also will be at the risk, but the intensity and the frequency of a severe climate change event is going to increase for the next year. So we need to be ready together. These are the reasons. We are not sure we are special, but we learned from suffering.
So you told us what you did. Looking back now, what did you not do? Where did you fall short?
We wouldn't advise you to take alone any kind of responsibility. You are not going to succeed. So go together, as the traditional African traditional says. If you want to go far, go with others. If you want to go fast, then you can go alone. Thanks.
But to change your mindset from survive to thrive, to go to survive it, you stopped at survive, but how does Mozambique go to thrive?
Then we put a little bit of our experience that we gained with regard to COVID. Yeah. We put other 2 factors. One, put science to drive the interventions and to put together evidence in order to have policies that are based on evidence. The second is to have the highest political commitment. Without it, you are not going anywhere.
So you actually brought us back to the title of this panel, which is political commitment and financial responsibility. So thank you very much. That was good. Maziko, we are coming to the end of our panel. Thank you. So Maziko, you are the activist on the panel.
Thank you.
You are a first responder.
Yes.
You have the floor, and we'd love to hear from you, your experiences, Cyclone Freddy. What did you see? What can you tell us? And my question to you, is the glass half full or is the glass half empty?
First of all, let me thank the organizers for inviting a community activist to be at this important panel. And I want also to thank my minister here and also people from Malawi who are watching live on live streaming. First of all, I was one of the first respondents to Cyclone Freddy when it happened in the southern of Malawi, which is also closer to Mozambique. And then we took it upon ourselves. We thought it was a normal rainfall, but later we discovered that it was disastrous. So I happened to be in the southern Malawi at that time, and I had to call the hospital close by, the central hospital, to find out what's going on, because the rain was coming non-stop almost for 2 days. And then we discovered that the hospital was full of blood. Ambulances were short supply because I think the health sector didn't anticipate the magnitude of Cyclone Freddy. Then we discovered that it was Cyclone Freddy, and it required a lot of effort to be done. So as a community activist, what I did was I went to the TV, local TV in my town, because most people didn't know that this is happening, because I was myself in the hospital, in the central hospital, so I saw it with my eyes. What we can do by engaging other players. Fortunately, my minister here and others came almost immediately the same day. And I saw that cooperation of different ministries coming at one place and be able to address the issues at hand. I must say that when I look at it, and I'm happy as an activist that last year, when they're discussing about COP28, they included health, climate health as an issue. For me, I was so happy because at the beginning, we thought that people didn't realize, but Cyclone Freddy taught us a lesson. One of the lessons which I can share with the crowd here and the global world is that we have had made gains in HIV and AIDS. We saw some of the disruption in facilities and hospitals. And also people were unable to access HIV ART services because if the hospitals and the facilities are not operational, and even health workers were displaced. So we had to have a plan how to make sure that people are reached and be able to receive ARVs, but also expectant mothers who are expectant. So even also including people were disrupted, they were living in camps, and I had to visit some of the camps, and people are not used to live in camps. So issues of HIV infections and STI, because people live in camps, is an unusual setup. You come to Malawi, you understand what I'm talking about, because we're a low-income country and we have so many challenges like Mozambique. So I must confess that climate and health, we cannot separate. We need to make sure that investment, we also need to sustain the gains we have made in HIV, TB, and malaria, make sure that resources are available, but also make sure that health and climate are part and parcel of the future we want. Thank you.
Thank you. I've heard your minister talk about one plan, one budget, one measure. What do you think?
Yes, indeed, we have worked with the ministry. In fact, being one of the support of one plan, one budget, and one D, I'm happy that the GFF is here and the Global Fund, because we're also talking about the alignment agenda. We had challenges where resources, pooling of resources was been a challenge in most of the countries because of the nature of our countries. So yes, I'm one of the prominent of one plan, one budget, because in issues of climate change, we need to have resources available. I shared an example where the hospital was unable to do certain things because there are no resources, because they're already earmarked to certain areas. So one plan, one budget is the way to go in terms of even addressing issues of climate and health, but also other challenges which we can face as a country.
So the glass is half full?
Yes, thank you.
So thank you, my panel. Just to summarize, I think Maha talked about not giving up. Pia talked about involving youth. Amanda talked about making sure we work together and go far, not fast. And you've talked about how the glass is still half full. Thank you very much.
Wow. Thank you. Thank you very, very much, Naveen, for that. And thank you to Dr. Naveen, Dr. Maha, Dr. Tiago, Maziko, And Naveen, listen to this, and Dijkstra. So I got that right. Yeah. All right. So we are now going to go to our next panel. And the next panel is titled Country-Driven Climate and Health Actions and Financing Needs. We have a mix of health, environment, and climate ministers. This is really powerful because this was not, it's not something we thought we'd do before. We're bringing together all these different ministries and sectors to address one common problem. And to moderate this panel will be Dr. Maria Naira. Please join me on the stage. Dr. Maria is a champion of climate and health. She was an ally all the way before COP28, after COP28, into COP29 and COP30, and I don't think the allyship is ending anytime soon. Never, yeah? Good. Welcome here. I would like to invite the Minister of Health from Malawi, Excellency Kumbize Kandodo Chiponda, Member of Parliament. Thank you, Minister, for joining us. I would like to invite Excellency Isiaq Kunle Salako, Minister of State for Environment, Nigeria. I would like to invite Excellency Sabar Hossain Chaudhry, Minister of Environment, Forest and Climate Change from Bangladesh. Welcome, sir. And finally, I would like to invite Excellency Dr. Awa Marie Coll Seck, former Minister of Health in Senegal. Welcome, Dr. Seck. Over to you, Maria. You're 19 ministers now.
Hello. Thank you. Thank
yes.
you very much.
Let me take out your 30 seconds. That the minister has requested to leave after her submission because her first lady is around and she'd like to run and support the government. Is that so, Minister Chiponda? Thank you.
Okay, we will negotiate that. Thank you very much. Dear ministers, we have a challenge here. The previous panel was perfect and they finished on time. So I want you to be even better, please. Okay, can I have your agreement? Yes, all of you, fantastic. Very good. Minister Chiponde, before going into the serious business, I need to ask you a question. Do you still have in Lilongwe gelato place with Italian ice creams that we, during the war in Mozambique, we used to go there? It still exist? Okay, thank you. Oof, you reassure me because that was really something. I mean, anyway, seriously now, we heard before the situation at global level, the negotiations, the COPs, what we have achieved at the COP28, the GPW 14 that has been approved, all of these fantastic things, the resolution that hopefully will be, I'm sure it will be approved as well. Let's now go at country level and understanding a little bit better what is happening there, what are the needs, and how you ministers you are coping, because at the end of the day, I'm sure that you are the ones confronted with all of that and the ones that will tell us the challenges. So starting with you, Minister Chiponde, for you, climate change affecting health is nothing new. You feel it, you know very well what it is. So my question to you is very simple. How do you cope with that? I understand that you have been a champion on financing climate change and health, making sure that you work across other sectors. How do you do it? What's your experience? What can you share with us for us to learn on all of this?
Thank you so much for the question. And let me also thank the organizers for inviting us to be part of this very important conversation. I will not say much because Maziko was here, has already, talked about the situation during the Cyclone Freddy. But we also had several cyclones the previous 2 or 3 years. And then we had the West Cholera outbreak, which lasted a whole year, whether it was raining, whether it was summer, whether it was cold, which was really unique. Because, cholera conditions, it has to be raining, not when it's very cold. But that was what was happening. And of course, the disease pattern of like malaria has changed. And this year we are having so many cases of severe malaria, even adults, having conversions. Almost maybe 25% of the admission, it is because of malaria. Yet we are doing so many interventions with the help of Global Fund, PMI, we are distributing mosquito nets. We give prophylaxis to the pregnant women. We do rescue indoor spray. We're doing so much. And we have introduced almost 2 million children on malaria vaccine, yet the burden is still rising. So those are the questions which we ask ourselves, what exactly is happening. So a lot is happening, but at the same time, you seem like you're stuck in one place. I'm happy you mentioned COP28. I was talking this morning, I was asking myself, I said COP28, it was last year. Really, have I seen any difference in terms of issues of impact of climate change on health, in terms of help or what? No, I have not seen. So I think, to me, let me dwell on those which I feel the challenges. Because when you're talking of, you have a crisis. Cyclone Freddy, it's a crisis. You need help like there and then. You do not have time for somebody to tell you that you have to submit a 50, 100-page proposal for you to access the funding to address a crisis. It doesn't work like that. It doesn't work like that. You know, and then you have some other organizations, they'll say, no, we have the money, but you know, even for us to come up with the kind of proposal they need, I have to go to another organization to look for $1 million to get a consultant, an expatriate, who just to come and help me to put up a proposal, not even to get the money, just to write the proposal. It takes months, years, and years. We are talking of a crisis. People are dying, children are dying, mothers are suffering. For us, malaria, when you have malaria, it means at a minimum, it's 1 week. You are bedridden. So in a village setting, if the mother is sick, the whole house is sick. The child who's going to school, if it's a girl, it means they stop going to school to look after the mother. So you can imagine the economic impact of malaria. It's not just the sickness, but it affects the whole household. So these are the issues which we're talking about. So when we're saying, no, we need help, we need support, but the conditions as well, the flexibility, you know, those are the things which I think it's high time we need just to talk about these things. Otherwise, we have been talking and talking. We know exactly what we want to do. I'm happy you talked about the one plan. We already have one plan, and we established that one plan with the help of all our partners in Malawi. We sat around the table, said, no, this is the plan. All of us will go by this plan. And this is the resources which we need. We costed it. Us as government with our partners. So all of us, we know exactly what we want to do, but we need that extra push because the crisis is coming to a system which is already not perfect before even the crisis. So you can imagine the challenges which are there. Let me stop there for now. Thank you.
I think you deserve it. Thank you so much, Minister. Very, very strong messages, and I see many people noting while you were talking, so I'm sure that there are many others that agree with that. It's a very good lesson for all of us. I would love for you to stay, and if you can afford that, please stay. If not, our negotiation for you to go is okay. You can leave us. But say hello to the ice cream, please, for me, because they made my life easier. Thank you very much. Moving now, do you want to leave? Okay. I understand. Thank you so much for coming. Thank you very much. Thank you. Thank you very much for the very strong remarks. We move from Malawi, which is not a huge country, to Nigeria, which is definitely a huge country. And let me ask you, dear Minister Salako, you have a national health strategy. And my understanding is that you have been taking care that within the national health strategy, climate change is very predominant and is taking a very important role. Was it easy? Did you negotiate with many other ministers on your government? How did you convince others? And do you think that you will manage to maintain climate change very high on this national strategy? Over to you. You can use this one.
Thank you very much. And let me first thank the organizers for inviting me to be part of this panel. Nigeria is a big country, like you mentioned. And for me, as a Minister of State for Environment, Having trained as a medical doctor and practiced public health for several years before I was appointed, I'm able to see more clearly the importance and significance of climate challenge within the health sector. And I'm also able to navigate much more easily because the health sector accepts me as one of their own. And of course, the environment sector where I represent, obviously, will also accept me. So I think that's helped a lot in trying to negotiate understanding and working together in ensuring that climate issues become very prominent in the health sector agenda of my country. The One Health approach has also helped tremendously because a lot of time things are now being done within the mindset of it goes round from you were not able to say that this is just purely health or purely environment. You're able to see the nexus between those two very important areas. Of course, we are also able to take this to a lower level, getting the primary healthcare workers at the local government level to also work very much more closely with the environment health officers. Nigeria has about 60,000 registered environmental health officers who work at the community level, at the village level. And of course, we also know that most of the primary healthcare workers also work at this level. So taking the One Health approach to that level has also helped tremendously in driving the agenda of putting climate health in more context within the health agenda. Of course, also trying to raise health workers that are more informed, what I call more climate-centric, is also very important, you know, because prior to now, while I was training as a medical doctor, climate was not something we were taught. We didn't know, nobody taught us that there was an issue around climate that will affect how we deliver health care services. But now that is become a topical issue, so we must also, and as a result of that, now we're running courses on One Health. And as a matter of fact, my ministry is cooperating with one private university to even do One Health course at postgraduate up to PhD level. And I think such innovative approach will help to situate this challenge of climate health more within the health sector. Thank you.
Thank you very much. Do you think that because you are a medical doctor by training has changed a little bit in the influencing and making sure that climate change was part of the national health strategy, or we can rely on other professions as well?
Well, I think that by and large, climate challenge is something that is staring everybody in the face. I think by my being a medical doctor just added a little leverage for me, but clearly all professionals seem to appreciate that this is a very impactful challenge that we need to address.
Thank you very much. We move now to another even continent, dear Minister. Dear Minister Chowdhury, is that correct?
Yep,
from
correct
Bangladesh.
Enough, near enough.
You know, a couple of years ago, I was in London and they were reaching 34 degrees and they were panicking. It was too hot for London. Unfortunately, in your country, I'm afraid the heat waves are now one of the biggest challenges you are facing. So what are you doing and what has been the consequences of these very prolonged heat waves? How is the health system coping, or what extra measures are you taking to face that?
No, you see, when you have something like a heat wave, it puts tremendous pressure on the health system. And quite often countries like Bangladesh have to choose their priorities. You know, here we are talking about coupling climate change and health. And climate change itself is underfunded. And now you're taking on another agenda. And so how do you manage these all? So resilience of our health system is something that we have started doing since the Sendai framework. Because if you remember, the Sendai framework actually talks about resilient health systems. So we have taken our cue from that. Now, of course, we have, when we are doing the new National Adaptation Plan, we are putting in all of the health risks. And it is not just the heat waves.
we have to look at slow onset events. So by that, I mean rising sea levels, I mean salinity intrusion, I mean melting of the glaciers, which leads to water stress. I mean the whole issue of biodiversity loss, the intensity and frequency of disasters. So we have to contend with all of these, and it's not just one. So I would say it's not just the I would say extreme weather events, but is it a whole spectrum of events that we are having to deal with. And if you just imagine a map of Bangladesh where it sits, you have the Hindu Kush Himalayas to the north, and you have the Bay of Bengal to the south. And we are squeezed. On the one hand, we have the melting of the glaciers taking place at an unprecedented rate, and we have sea level rise. And then all of the other challenges that we have in between. So I think, also going back to the first session, the challenge really is means of implementation. I know we are getting excited, and we should be, the fact that health has been recognized. But the point is we have so many agreements, we have so many commitments, we have so many pledges. And I was talking to Naveen earlier today, and I said that now the needs are in trillions, and we are trying to meet the trillions when the billions have not been delivered. So each time, we have pledges, and these are promises unkept. I think Bangladesh has the plans. We have the local level adaptation. We have been able to engage the communities. But if you don't have the funding, there are limits to what you can achieve. So in the current financial year, the government of Bangladesh, under Prime Minister Sheikh Hasina, has allocated $3.5 billion for adaptation, and that also includes health. Now, our annual requirement is about $9 billion. So where is that money actually going to come from? And it's not just health, it's also water resources, it's food security, it's nutrition, it's women's health. And I see there are a lot of women here. So when you have salinity intrusion, women are taking in a lot more salt. So with that, what happens? You have kidney issues, you have respiratory problems, you have hypertension. So the whole issue of One Health, when we look at humans, animals, and the environment, is now being threatened. So it's a very steep challenge, but I think it's the means of implementation. The words must be acted upon. The delivery must be made. And I think, in the first session, Naveen talked about political leadership, and he talked about, funding. I think the other big thing is global solidarity. There is a huge trust deficit globally because we are not able to trust each other. Promises and commitments that are made are not actually honored. So perhaps health and climate change is where we are going to turn a new chapter.
I really hope so. Thank you very much. I don't know about you, but I'm extremely happy of my minister. So, and the last one, I'm sure that she will be excellent as well. Don't let me down. Madame la ministre Kolsek, je crois qu'on doit parler, we speak only in English, correct? There is no simultaneous translation. Okay, on va le faire en anglais. Madame Kolsek, you have an incredible experience. You have been fighting yourself in Senegal with climate change. You know very well, now you're a professor, but you know very well what that means with the rising level as described before, and what that means to not have the finance that are needed to implement your plan. What do you want to share with us, and what are the messages for those here today, leaders, financing, philanthropists, and negotiators?
Thank you. I would like to just say that in Senegal, we have been working at different levels. At the level of the sub-region, where we organize the first very important integrated meeting with Minister of Environment, Minister of Health, and Minister of Agriculture and Animals to work together with all the countries in the sub-region. And this was a sort of call for action of working together and the issue of integration and One Health. This is at sub-regional. At national level, we have been working a lot to plan, and we have all the plan necessary. But at the end of the day, we have been able only to work at small scales because of lack of all the resources we needed. And at small scales, it was for example, the coastal, we can say preparedness to avoid all this sea level growing, to be able to create a lot of problem in the coast. And this is very important, but very small scales of activities and initiative, going from, for example, sea walls to break waves and planting of mangroves and things like that. But I want to say that without enough support, but also support going and reaching the communities, we will be speaking a lot, but at the end of the day, we will not reach what we want to reach. And I am very happy to see that we have more and more pledges, more and more funds, and the next panel will work on that, we'll speak on that, but we need to ensure that we have enough flexibility, enough way we are working together, avoid silos, and all these things, be ready for this money to come. But without that, domestic money need to come also, because we cannot just wait for others to come with money, but it will not be enough if we are not really having all the pledges we are looking for or hearing, because we need to have it particularly at community level. This is almost what I learned from our experience in Senegal.
Thank you very much, Professor. Thank you. And I think we are perfectly on time, so no complaints at all. I think you heard it very well. They have suffered at country level the consequences of climate change on the health system and then the health of the people. Please,
just a very quick intervention. You know, I think we all have to appreciate that. Are we going to treat the disease or the symptoms of the disease?
Yeah.
We cannot have a situation where climate change continues to get worse. We pump emissions into the air, and then we talk about resilience and adaptation. So resilience and adaptation have their natural limits. At the end of the day, unless we are able to control our emissions, I think it's going to be an even steeper challenge. I just wanted to make that point.
Thank you, Minister. This is fundamental. Phasing out fossil fuels. So again, you heard from the countries, they know what the consequences are. They have national plans. They believe on solidarity. They still believe on solidarity. They are waiting for the financial resources to implement what they know, and they know how to do it. So this is on your hands now, financial support. Thank you very much. Thank you.
Wow, thank you very, very much. Resilience and adaptation have their natural limit. It didn't escape me that the Minister of Environment from Nigeria was wearing green as well, immaculately dressed in green to represent environment. That's actually a well-thought strategy. Now, we are going to our last roundtable, as it were, or panel. And that panel is going now to advance this agenda of financing climate and health. And to moderate that panel, I'm going to invite Juan Pablo to come up. No, Peter Sands, sorry. Juan Pablo is your panelist. Yeah, I'm sure he can. Yeah, he has the money from World Bank. So welcome, Peter Sands. Peter Sands is going to moderate this panel. And the panelists on this will be Juan Pablo, please, welcome. Yes. Juan Pablo is the Global Director for Health, Nutrition and Population and the Global Financing Facility at the World Bank. Next is Excellency Ambassador Alexandre Ghislaine. Please join us up here. Excellency Alexandre is the Special Advisor for International Affairs of the Ministry of Health in Brazil, which is hosting COP30. And then we have Samrita Sinthu, who is head of Global Health Institutions Department at FCDO in the United Kingdom. We also have, yes, please. We are also going to be joined by Oyun Sanjasuren, Director of the Division of External Affairs at the Green Climate Fund. I hope she'll discuss the number of pages that were raised by the Minister of Malawi. And then we have Tala Al-Ramahi, Chief Strategy Officer, reaching the last mile. Welcome. Over to you, Peter Sands, and this is your time. Your 19 minutes starts now. Thank you.
Thank you, Gitinji. Panel 3, we have 3 challenges. One is we're the 3rd panel after 2 excellent panels. Second is, as Professor Kolsek pointed out, they're looking to this panel for the money. I'm quite glad I'm the moderator. And third, we're between the audience and the drinks reception, which doesn't mean you should be short, but you should be sparkling. So, with that as our challenge, can I start with you, Juan Pablo? The World Bank has obviously embraced climate change very actively. Can you talk about how the nexus of climate and health has been incorporated within the broader agenda of collaboration, of reform?
Peter, thanks so much. And I'm going to be quick.
Sparkling.
Sparkling. But I also want to be, let's say, solid and bring some new things as well after these great panels. So as you said, in the World Bank evolution, and you know it very well, and there are people here who know it also very well, the bank has embraced climate as core to its mission. So much that the mission has changed to reflect the livable planet that we all need to construct. Our tools, our instruments are also evolving to address global public goods like climate. Our commitments have gone towards climate, and most of you know that the bank is committed to invest 45% annually of its resources in climate-sensitive interventions. And finally, the scorecard through which we're going to be monitoring our progress and be accountable for it will also reflect climate. So a lot done there. But I want to talk quickly about 2 additional things that come in that evolution and that are core to climate and health. And here we have Tamer Rabi, who's leading our climate team, and a huge recognition to him and to all the colleagues in the bank who are working with all of you as well around this. And it's partnerships, and it's also private sector. So quickly on partnerships, I cannot stop without making reference to a partnership with you, Peter, that you brought up with Ajay Banga as well, where one of the pillars of a closer work between the Global Fund and the World Bank is precisely climate and health. We're identifying countries where we can come together in a complementary way to help the leadership address their particularities on climate and health. So it can be Mozambique, we had the minister here, it can be Nigeria, it can be South Sudan as an example. So that's I would say an important message, and it's we can come together and be complementary. Another important example in which we're working is developing banks working group. And this is important because of the financing aspect that all development banks can bring together multilaterals with national banks. So the 6 multilateral development banks are there, and 4 national banks, public national banks, have also come to align their efforts in financing with a little bit more of content, and I'll go into that quickly, around climate and health. We have Brazil, Ambassador, coming in, the National Bank of Brazil. We have Rwanda, we have South Africa, we have Turkey. And hopefully more banks will come around this, because we need all the efforts of all the banks that can come together around this. This working group is going to present in June 12th, next month, a roadmap. And in that roadmap, you're going to identify very specific efforts, Peter, that have to do with aligning at the end the financing support for countries, but around specific country needs, clear identification of the opportunities of investing, building capacity, which is very important at the country level, below the national governments, supporting evidence-based interventions that the countries are identifying, and of course, again, mobilizing the resources and being accountable in the results that this can bring. So bottom line there, big partnerships that we can do, and development bank working group that will bring, we hope, a lot of strength in the financing to climate and health. I want to end with the private sector, and I want to end with an example that is close to you, because we've also been working together there with Minister Budi in Indonesia. So Minister Budi is leading, with the support of many multilateral development banks and other institutions like the Global Fund, a comprehensive health system reform. And within that reform, he's mobilizing private sector. I could stay talking about all the elements that he's bringing into a structural reform. But one thing that he has done is that he brought what is called, I need to read it, as the sustainability low carbon criteria into procurement. So when the reform in the system goes to the private sector to bring inputs, to bring technology, it takes into account the low emission of carbons as a key criteria for shifting and shaping the behavior in the same market in the country. And I think that's an incredible way to mobilize the private sector, to align the interests of the private sector with the public good, and to create a sustainable behavior that is climate friendly. So again, take that example from a country leading in private sector mobilization. And I just want to close by reaffirming this call, Maria, that you always have done, of all coming together around this big challenge. We need to avoid fragmenting further the space of the health systems with a siloed climate focus. It would not help our countries. It would not help our ministers to have one more competing need, in a way cannibalizing other needs. So we need to be very, very intentional in integrating effective responses, supporting country leadership, working together. Over to you.
Perfect, thank you. You talked about the MDB working group on climate and health. Another working group that has put huge focus on climate and health is the G20 Health Working Group. And Brazil, in its G20 presidency, really sort of pushed that forward. But Brazil has also had its own direct experience of the impact of climate change on health. Can you talk a bit, Ambassador, about both Brazil's experience, but also how Brazil has been using the G20 presidency to push this agenda?
Yeah, sure. Thank you. Thank you very much. Thank you for having me. And please, I'll just beg for your indulgence since you're speaking before the cocktail. I mean, but let me just say a word about our experience and what we have been facing in Brazil when it comes to the nexus between climate and health. It's no longer a theoretic theme for us. It's if you, I'm not sure if everybody has followed the climate disaster that we are facing in the south of Brazil. What has happened, in a word, is that the rainfall expected for the whole Amazon region was directed to only one state in the south of Brazil. So you have some 400 municipalities affected, an area of 30,000 square kilometers is underwater, plainly underwater. And by underwater, I mean it's a 2-meter layer of water, even in the capital of the state. And it has affected health in a number of ways. First of all, a number of people have died, of course. They were taken by the waters. Second, we are now having an outbreak of diseases, leptospirosis. I don't even know how to say that in English, but I hope that's right. And others are coming up as the waters go down. And when the waters get back to the regional level, the aftermath that we are going to face is that hospitals are destroyed, primary healthcare units are destroyed, you have to rebuild the whole health infrastructure. So, well, imagine what that means in terms of health perspectives in the short and the medium term. And since you're talking about money, how much money would be needed to rebuild the whole infrastructure of a 10 million people state? So it's not a theoretic thing. We came up with a strategy on climate and health before it was fashionable, so to say it. I mean, it's a month before that, right from the start of our presidency. And the way we have been envisaging this is threefold. First, we would like to use the convening power of G20. As you may know, G20 has a health working group, and which meets at ministerial level. And we are having a high-level meeting exactly on climate change and health, including some other dimensions like One Health and AMR and the antimicrobial resistance, so that we can bring the attention of the health community in a stronger way to these issues. We hope that we can adopt a declaration on these issues, a G20 declaration on these issues by the end of the year. That's one way that we are mobilizing efforts. The second way is we have committed to support the pandemic fund. We are holding a pledging event for the pandemic fund together with our health ministerial, so that they will be in a better position to fulfill their mandate and better prepare countries when it comes to surveillance and health workforce, and the third priority is laboratory trials. So we would like to help them meet the needs of the international community. Besides, we are also engaging in a very deep way with the WHO in order to push forward the investment round. We are going to promote it in our ministerial. We're reserving a moment in the Leaders Summit so that we can bring this issue to the attention of the leaders of G20. And so that WHO too can be in a better position to deal with all its mandate, including climate change and health. And this is the second dimension that we are approaching. And the third dimension that we are approaching, then G20 is just, it's a means to it. We are also thinking already of COP30. As you may know, we are going to be the hosts of the 30th Conference of the Parties of the Paris Agreement on Climate Change. That will take place in November 2025 in Belém do Pará, north of Brazil. And our Minister of Health, Minister Nízia Trindade, has already announced that we are going to have a dedicated session to climate change and health, so that we can build on the legacy of the COP28 held in Dubai, to bring more attention to this issue and hopefully make more progress. So these are the contributions that we have been able to come up with, and we count, on our on all the members of the international community to make them a success.
Thank you, Ambassador, and the thread through the direct experience that Brazil has of climate change through your leadership of the G20 through to COP30 is a very sort of powerful narrative. Talking about COPs, actually the first COP where climate and health really began to be discussed was the COP26 under the UK presidency. Samrita, since then, the UK has continued to be very much a leader in talking about the nexus of climate and health. Can you talk a bit about how the UK expects to continue to show that leadership and deliver impact through both the bilateral and your multilateral relationships?
Definitely. Thanks, Peter. And just to say, it's good that COP26 feels a long time ago, and that is all credit to the people in this room, those watching and supporting. But I have to pay credit to three parties in particular. First, obviously, UAE for COP28, Netherlands and Peru for the resolution that will hopefully be passed. But I think all of us are equally humbled and inspired by the country leadership that we've heard today and that exists outside this room. So it's good to see that the glass is slowly half filling. I think just in terms of the UK's approach, there's two framing comments which I actually think pick up on other comments. And the first is that the solutions to this problem are both inside and outside the health sector. So we have to take a multi-sectoral approach to it. And what others have said about it not being vertical or siloed is absolutely key. And then that leads to the second framing principle for the UK, which is we have to work in partnership. We have to have excellent coordination. And that is to ensure both complementarity, but also to really spot the gaps and look for innovation in our response. So those are kind of the overarching principles that we try to abide by. But then getting a bit more granular in the UK approach, we're trying to do this in every instrument and every engagement we have, basically. So I will try to stick to the 3 minutes, but please interrupt if I get too excited. So first of all, bilaterally, we have a number of country teams across the globe. Wherever they have health programs, we are trying to ensure that they put a climate change lens on that. But in some countries, we're going further, and it replicates the experience that Mozambique Minister was talking about. So for example, in Nigeria, we have supported a vulnerability and adaptation assessment, and now we will work with government and other partners to develop that into a national adaptation plan for health. And the reason why that is so critical, as others, I think right at the start said, is that NDCs often refer to the importance of health, but then they don't get into the granular level of what do we do about it, what is prioritized, what is the cost, what is the intervention that we are actually going to go for. So that's critical. Then going on to the GHIs, and obviously the Global Fund and others are key partners on this. We are one of the biggest funders of the GHIs, and we obviously use our seat on the boards to kind of raise this challenge continuously. But we're also in a pretty exceptional year, 12 to 18 months ahead, where we've got the replenishments of WHO, Gavi, Global Fund, IDA 21, Pandemic Fund. So it's all happening at the same time. And I think there's a real opportunity here, because what we are pushing for is that these replenishments take a strategic and climate-focused approach. The questions that we would like organisations to be answering are, for example, if you look at your operations and your allocations and you look at the shifting burden of disease, what does that mean for you going forward? And I think the Minister of Malawi was picking up on that in terms of those shifting needs going forward. Secondly, we're doing loads of investments collectively, right, on health system strengthening, but are we genuinely making sure that those are really developing climate resilient systems and greening the entire supply chain as far as we can do? And thirdly, we really do want to ensure that each organisation works within its mandates. And two great examples here, obviously, there's a real opportunity with WHO and GPW14. If we get the investment round right, that we can use WHO's country leadership to embed kind of that focus on the social and the environmental determinants of health. Another great example is Unitaid. Like Unitaid have focused their strategy and incorporated climate on it with a focus on climate resilient products. So how do you have more health interventions which are more effective in a wider range of temperatures, for example? So there's real opportunity if we get these replenishments right. Going on to multilaterally, I'll try to be brief on this because Juan Pablo's gone into quite a lot of detail already, but I think the biggest opportunity for the banks and the RDB is really that multi-sectoral approach, right? Because you have such big portfolios in energy, agriculture, transport, all of which also impact on climate and health. And so going further and faster there. And then just to sum up, because I have to get this in, and it's just so important that it gets to the point on partnerships and innovation. The UK also really invests in other instruments. So we've been real supporters of climate resilient debt clauses, because we need to ensure that countries that are dealing with compound shocks have fiscal space to keep sustaining capital investments in health. And then the second thing is disaster risk financing. There's a real opportunity here. I think Malawi, Mozambique and other countries are involved with Africa Risk Capacity already on this. But how do we bring these different instruments closer together? So disaster risk financing is working much more closely with disease management systems. Thank you. I hope I haven't gone too long.
Very good. In fact, you didn't mention that the UK is also a significant investor in the Green Climate Fund. Oyan, as the the leading multilateral fund for climate mitigation and adaptation. How are you looking at integrating health into your program financing?
Thank you very much. So first of all, thank you to the UK as well for being one of the largest contributors, but also UK is co-chairing Green Climate Fund this year. So hopefully also co-chair will prioritize integrating health into climate as well. So first of all, we're as a Green Climate Fund, we're very happy to be this week in Geneva, but also we're very impressed to see the health ministers speaking about health and climate resolution as one of the priorities. And of course, you know, we're very delighted to see the prioritization both at the global level, but also at the national level, because this has not been the case if we see the pipeline of projects that are coming towards GCF. And of course, not only the health sector, but also climate global sector has to step up and then prioritize health as well. So Green Climate Fund is starting the new programming period, 2024-2027. We've just concluded the major bulk of our replenishment. It will be about 1/3 larger volume in the programming because we've done sort of larger replenishment compared to the previous one. And health will be a priority in our programming in the next 4 years. As I mentioned, this was not the case. If you look at the past projects and programs approved out of $14 billion volume of climate funding approved, maybe for 250 projects in 129 countries thus far. With co-financing, it's 50 billion plus. We only see 2 health sector projects, health sector alone projects approved, but then of course there are another 13 with health co-benefits. In total, it's about 500 million funding from GCF. But then the good news is, so this is not enough, of course, for the health sector projects, but the good news is that more projects are forthcoming. So I think there is a more realization, of course, you know, of the priority. And we were discussing this morning at the Foundation S roundtable that there's a big chasm, not only among the global climate and global health community until recently, but there is also chasm within the countries themselves. I myself come from a developing country. I used to be a member of the cabinet and Minister for Environment and Climate, but very rarely I would reach out to the health ministry. I would go first to the energy ministry, transportation, maybe construction, and even agriculture, but health will sort of come less. So I think it's very important also this integration, but also coordination at the country level, at the global level. One thing I would like to mention is the I think, it was mentioned by the World Bank, the framework, the principles, the methodology of different financing institutions have to be made not only very transparent, but also we need to sort of try our best to make it easier to access. So it's not only the new programming period, but GCF is under new leadership. We have a new executive director, which is prioritizing also reforms in simplifying access, but also introducing efficiencies, reforms as well. I just wanted to mention one more thing. Of course, doing homework always gets good marks, and doing homework well also unlocks finance as well. So I would like to mention, for example, UNDP and WHO, together with GCF, investing relatively small amount of money, 1.5 million each, 3 million to do the project preparation facility, which will hopefully unlock $122 million worth in health and climate funding for a dozen of countries to improve also climate resilient health systems as well. So I'll stop here, but it's definitely not adequate enough. And we just need the global health community and global climate community have to rise and play their part to face the crisis, as was mentioned this morning, but also to deliver as much and as best and do the most as most as we can. Thank you.
Thank you, Ian. Thus far, we have mainly talked about public money. Reaching the Last Mile is private philanthropy and has done a wonderful job on tackling preventable diseases that afflict the poorest, the most vulnerable. And your approach has always been one of kind of trying to catalyze others to try and leverage what you're doing. How are you looking at this nexus of climate and health?
Thank you very much, Peter, for the question, and thank you for inviting Reaching the Last Mile to be a part of this critical conversation. As a private funder, and as you mentioned, Peter, Reaching the Last Mile has been a donor investing in disease elimination globally, particularly on infectious diseases. And of course, we cannot talk about infectious diseases without really understanding how critical climate change is affecting progress and global health gains that we've all worked really hard to pursue. We've seen this through re-emergence of malaria in various geographies where malaria has been wiped out or eliminated. We've seen also, as we've heard from many speakers before me, re-emergence of diseases within countries through climate change disasters, including in the UAE, where we've been very privileged to have resilient health systems to address. But I'm sure many of you in the audience who have been following the news have seen that the UAE witnessed the worst storms in 70 years. These storms have also resurfaced dengue as a health concern within the UAE, which only lends us to be more acutely aware that climate change is a risk to everyone. And just really reflecting how important resilient health systems are. In terms of how philanthropy can play a role, I think we've heard a lot about the importance of global leadership on this agenda. We've heard a lot about collective action. And then, of course, we've heard a lot about the importance of the financing that can be available to countries to address the challenges that they're facing due to climate change and affecting the health of their communities. For philanthropy, where we believe philanthropy can play a critical role is being much more agile in provision of funding, but also much more agile in investing in innovations and identifying innovations that can be scaled up. As a funder in global health, we understand that obviously their countries, as we've heard, have faced significant challenges in accessing funding. And Her Excellency Dr. Maha Barakat from the UAE, you heard from her earlier today about what success means for COP28. I think, COP28 really signified how collective action can be important in elevating the climate health agenda. $1 billion mobilized in climate and health financing. But I think where philanthropy can play a role is making sure that countries can access that finance. We can do that by de-risking and investing in blended finance models. But also more pragmatically, we recently commissioned a landscape research report with Rockefeller and Foundation S, in fact, to better understand the financing landscape around climate and health, and to provide a very comprehensive understanding of the financing flows for climate and health, and more practically, how those flows are getting to countries. And we hope to be able to publish the research of that report very soon. I think as well, when we talk about philanthropy plays a critical role in addressing market failures or investing in opportunities where maybe there isn't a market incentive for the private sector and potentially even other donors. And that's where we often talk about PPPs, but I think philanthropy is the fourth P here, where we believe that philanthropy can really address some of these market failures to be able to invest in opportunities that invest in communities where they need that funding the most. In parallel, I think as well, we often talk about, of course, the need to invest in climate mitigation, but also in terms of climate adaptation. We often hear of various data points, but one that stood out for us is that 2% of philanthropic funding, only 2% of philanthropic funding goes towards climate and health issues. And that data point could be contested, because we could also say that any investment in climate is an investment in health. But I think there's still a real opportunity to be catalyzing more investments in climate and health. Excuse me. I think as well, philanthropy can play a critical role in providing the evidence and the data required for a lot of other funders to come on board. And that's where RLM can play a critical role in doing that. Maybe, I know because I'm officially the last speaker between us and the reception, just to mention that in terms of research, we actually, Reaching the Last Mile last week published a major scoping review with the World Health Organization, scrutinizing existing evidence around climate change and malaria and NTDs. The bottom line, and what we found from that research, is there is not enough that we know, but what we do know, unfortunately, currently is invested in understanding how climate change affects high-income countries, and that really is not enough. And we must do more to change that. Finally, where I believe philanthropy can play a critical role is to act as a convener, to bring players together. That's what we did as RLM during COP28 to be an anchor event during the Health Day. We worked very closely with the COP28 team in spearheading the agenda around Health Day, and we hope to continue to play a critical role in shaping the future health agendas of future COPs, including COP29, but of course also COP30.
Thanks, Tala. One word that Tala used that I think is important to stress was the word agility. Now, agility is not exactly the first word that comes to mind when you're talking about the global health community or even the global climate community. But actually, given where we are on climate and health, which is, I think we are behind the game, and that this is evolving and hitting people faster than we anticipated, we need a degree of agility that is somewhat different from the ways we're used to working. The other thing I think we need to, in a sense, rediscover or reinvigorate is a phrase that the minister from Bangladesh used, the phrase of global solidarity. The world of global health is characterized by very sharp inequities already, even before you think about climate change. The problem is climate change is hitting the very same people who are on the wrong side of that equation even harder. And so if we have any sense of common humanity, if we have any sense of global solidarity, if we want the global response to climate change to be one that reduces rather than exacerbates inequities, we have to move faster and bigger on this stuff. I don't think, all credit to this panel, they were great. I don't think we've entirely solved the funding equation here, but what I think you heard was it's really top of the agenda, and it's really something that every institution, every government entity, the philanthropists are working on. And so there's a real commitment to raise our game in response to this challenge. And with that, back to you.
Thank you. Thank you very, very much. And as you noticed, Peter, the moderator was very agile for these panels. We allowed you a few more minutes because you're talking about money. And now it's my pleasure to invite our co-host to come and speak. This is Vanina, and she's the Director General of Foundation S. So Vanina, then after that we can conclude. Over to you.
Thank you so much, Gitinji. Thank you. So everybody, it's been a long day. It's been day 2 of the World Health Assembly for many of us, maybe day 3, maybe, as I've heard from some colleagues, week 2 already also of some discussions and negotiations. So I am here as a co-host, Director General of Foundation S, and thank you to all the partners, all the organizations that we're working with. And I want to leave you with 2 very short thoughts. So it's all clear that climate change has become the defining challenge of our time. And one thing that we're also discovering is that its health impacts keep evolving. We thought that we were understanding what the nexus between climate and health was about. And just last week, a UCL study found that climate change is impacting brain health now, and that it can be worsening a wide range of neurological diseases and impacting mental health. So we're only really starting to witness the multifaceted, pervasive impacts that climate change will have or already has, as we've heard for so many countries, on the lives and livelihoods around the globe. And what does it mean? It's time for action, ladies and gentlemen. We are eagerly anticipating the WHO resolution on climate and health. And one thing that we are hoping it will strongly highlight is the need to ensure that communities can access flexible financing. We need now new models of philanthropy. We've heard it. We need new collaborations across the public and the private sectors. And we need to ensure that the capital that is here in this room can come together, and that this urgent mobilization that we hope is clear for all of us here can help everybody beyond this room to turn rhetoric into action. So yes, this requires a full systems approach, an integrated health planning, a One Health framework, but we cannot let perfect be enemy of the good. We will not succeed in getting all the financing that we need tomorrow. We already know that. But if we can help unlock some of the flexible financing for the communities in Brazil, for the communities in Kenya, for the communities in Mozambique, in Malawi, everywhere we heard about it, that will be a win. And that is why at Foundation S, we're trying to walk the talk. Yesterday, we launched a new Health Resilience Community Fund. We've been working with many of you in this room, and we're hoping that together more and more can come in service of the communities that we are here to support. So as we leave this gathering and go about our week at the World Health Assembly, I hope that you will keep today's great and insightful conversations in mind, and that you will consider the role that each of you can play to ensure that funding is available, but it's also accessible, and it's also made more flexible for the communities we serve. It's time for action. It's time to adapt. And I'll leave you with a few words from Martin Luther King Jr., who said, "Where do we go from here? Chaos or community? We choose community." Thank you. Enjoy the reception.
Well, we come to the end of such a fantastic session. We have taken away about 15 minutes of your reception time, but I hope it is worth it. I hear many things here. I hear number one is that the problem is with us here and now. It's not tomorrow. It's with us here and now. Many examples given. Number two, we heard that policy and advocacy without action creates frustration. I could sense the frustration in the voice of the Minister of Malawi. Third thing is that we must involve everybody, youth, women, girls, at the community level for us to be able to build resilience. The next thing is that we must not give up, but we must build trust so that we can work together, and that trust must be built community up. And it's important that the countries bring their best food to the table as well with domestic resources. But also domestic resources are not enough. Those countries that are most vulnerable are also suffering debt crisis and other crises. So domestic is not enough. We must bring money together. The other thing we learned is that this is not another vertical agenda. This is an integrated agenda. And yesterday with Foundation S at the French Embassy, we're also discussing the One Health approach, which was discussed here, that is an important thing. We must celebrate that there's a commitment from Brazil to actually have a health day, as we saw at COP28. We appreciate that. The next thing is that we need to be more specific on what we're asking for funding for. Vulnerability assessments, understanding the risks, and starting to say, this is where we need the investment. We heard very clearly from the Green Climate Fund that actually the amount of requests from the health sector are a pittance. $500 million out of 14 billion is what I had. But hope that this is accelerating. Even when we talk to our treasuries back in the country, they say, well, we haven't had any proposal from the health side, but now we're here. So now we work with one voice. But I also heard that we need faster, simpler, available money. And I'm encouraged that the Green Climate Fund says we are committed to simplify. We need faster, simpler, available money because this is a crisis. And also, we had the role of building health workforce, a health workforce that is actually integrated, not just vertical, that this health workforce includes environment, veterinarian, and we must go upstream to start with us, even our own medical education, that actually we embed this agenda upstream, not just downstream. And finally, that this is not only about resilience and adaptation, that it is also about mitigation so that we close the tap of carbon emissions. I was an MC, so I'm not sure whether I'm allowed an opinion like the panelists. And my opinion is that we must do carbon pricing. Carbon taxes is the only way that's going to actually change private sector behavior. Ladies and gentlemen, thank you and welcome to the reception. Thank you very much. No, I want